Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health. This is Mackenzie Sachs from Fast Blackfeet in Browning, Montana, here to tell us about their food pharmacy program. Welcome, Mackenzie, and thank you for being here today.
Hi, thank you.
Yeah, so can you tell us a little bit about your food pharmacy program and what you're hoping to accomplish with it?
Yeah, our food pharmacy program is a produce prescription program, and the goal is to address food insecurity and diet-related chronic disease. And we hope, to encourage nutrition education and better access to healthy fruits and vegetables and fresh foods.
Great. And how did Fast Blackfeet first get involved with the Blackfeet community?
Yeah, so Fast, initially it was formed as just kind of a group of community members, some people that have worked in different food, jobs, food-related jobs in the community, that were aware that there was an issue with food insecurity that wasn't really being addressed. So before it was even a nonprofit, they were meeting and they did a food security and food sovereignty assessment, and that showed that about 2/3 of the people in the community were reporting that they had experienced food insecurity at least some point over the past year. And then they also surveyed people on what kinds of programs and services might be beneficial. And so after that, they saw, this really is a need. So they formed a nonprofit and then opened the food pantry. And our food pantry is called Oyot Food Pantry, which means we are eating in Blackfeet. And that was in 2019. And then right around the same time, I would say, they always knew that they wanted to do more than just a food pantry. There were a lot of dietitians and nutrition people on the board at the time. And so they knew that it was also important to do nutrition education and cultural food education and gardening and things like that. So it's just kind of been growing since then.
That's great. So what services does the food pharmacy program offer?
Yeah, so our food pharmacy, we do vouchers for fresh fruits and vegetables that you can use at the grocery stores. And our participants right now are getting $80 each month. And it's just on any of the fresh produce section. And we have about, I would say there's 4 stores that are year round, and then there's 2 that are seasonal. So they can go to different places, not just in Browning, but some of the smaller communities on the reservation. And then they also can access nutrition education through the program. So that's either seeing me as a dietitian, or we have group classes. We can also connect them with other classes and things that FAST might not be providing, but our partners in the community are providing.
Great. And what results are you seeing, Mackenzie?
Yeah, we get a lot of really good feedback, just that the vouchers help people. They say they probably wouldn't have been eating the foods that they can buy with their vouchers if they didn't have the vouchers. So that to me is, a really big win. And then we have not really tracked fully the biomarkers with we haven't tracked to see exactly what the average A1C is or anything yet, but just from reports we ask, has your health improved? And people usually say yes.
Mm-hmm.
And then
Great.
I would also, sorry.
No, go ahead.
Also, we survey them about their confidence, and we ask their confidence in preparing healthy foods and confidence in choosing healthy foods. And those are usually 90-something% says that their confidence has increased.
That's great. And how are you partnering with Tribal Health and Indian Health Services on the program?
Yeah, so Tribal Health is our main partner. They're like our clinical link to the program. Actually, we have a relationship now where I'm kind of like their dietitian, and so we have all the HIPAA business associate agreements and the data sharing agreements and everything, and they let me use their clinic space to see patients. This is probably one of the first nutrition services that they've been able to offer to the patients. So, yeah, it's like, I think it's a really good partnership. They refer people to me, and then I can also refer back to them if there's, like, if a patient needs physical therapy or some sort of screening or something that I wouldn't as easily be able to refer to if I was just a dietitian by myself.
Mm-hmm. It's a good example. Yeah, it's a good example of it takes a village, like everyone in the community working where their skill is, their subject matter expertise. So the partnership sounds good. And how have you been able to sustain the food pharmacy program?
Yeah, another thing that we are doing with Tribal Health is we have an agreement to share in any of the reimbursement that we get from third-party billing for the nutrition services. So as a dietitian, I can bill for medical nutrition therapy or MNT.
Mm-hmm.
And so right now, it's pretty much most of the patients here are on Medicaid, and Medicaid only covers children under 21. But we have an agreement. So like any revenue that is received, we get a portion of that. And then the other appointments, like I still see adults, so those are, no charge. But that's something that we're hoping we can increase. And in an ideal world, eventually the program will sustain itself through the billing. But aside from that, for now, we've also been just grant funded. We have a good amount of like private foundation grants, and we've gotten state grants as well.
Sounds good. And what lessons have you learned in implementing this? And what advice would you have for others who might want to try this?
Learned lots of lessons, I think. So I think a big one is having a really strong team and a team of people that is available and has the capacity to do the work, because it does involve all different sorts of people, and sometimes people are really excited about it, but just don't have the time. So making sure that you have people who really do have the time for it, and setting up good communication right away, especially once things start to get routine. It's sometimes easy to kind of fall out of communication, and so just keeping that, keeping in touch and everything with everyone that you're working with. Another thing that FAST is big on, that at first I don't think I realized how important it was or why we were doing it, but now I see, is staying in your lane and like really choosing what you want to focus on. So you decided, we want to stay with food access, and that helps. I think the community knows like what they can go to us for and what we do, and then it prevents us from overextending ourselves, because we would love to do a lot of other things, but we just know that we'll do what we do best if we focus on one thing. And also being open to feedback. I didn't mention, we changed the program, kind of the design of it, at the beginning of this year. And that was just because we were seeing and hearing from our participants some ways that might be better to run the program. So yeah, just being open to feedback and willing to change if it feels like that's necessary.
And how would you like to expand the program in the future?
Yeah, like I said, since we changed our program, we kind of started from like square one in a way, where we had 0 participants again, and we're re-enrolling everybody. And so just growing, getting more participants and reaching out to more people. That's the first thing I'd like to do. And then down the road, we're still working on increasing what we can bill for the MNT. So that'll help us stay sustainable. And another thing I've been thinking about is adding vouchers for buffalo or bison meat, because our the Blackfeet buffalo program has, a tribal herd of buffalo, and they just started selling meat from those bison in the grocery stores. And I think it'd be cool if we could offer the fresh produce and also a traditional, lean, healthy, locally raised meat.
That's great. That's great. Good luck with that for sure. And so if you think back on the program, what do you feel most proud about for the food pharmacy program?
Honestly, just the fact that we started the program and that it's been working. And I think it was needed in the community. So the fact that now, this program exists, I think that's a huge win. I know that's kind of a simple answer, but just the fact that it exists, I'm proud of that.
Right. It actually went from an idea to a real thing.
Yeah.
That's a big thing. That's a big deal for sure.
I mean, I just like to say thank you to everyone who's involved with it. I didn't mention my coworker, Kishana. She is our nutrition education specialist. And so she plans all of the group classes and a lot of our recipes and things that we share on Facebook, and just keeping all of our participants engaged with our nutrition education and the clinic. There's also a great dietitian at IHS. So yeah, I'm happy that everyone's really supportive and on board with this program and helping out with it.
Great. Well, thank you so much for spending your time with us today and sharing information about this really valuable program. And good luck with the future.
Thank you so much.
All right. Take care.
Thanks.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.